Hi, this is Dr. Devika Godbole and I am a physiotherapist. Vitamin D is also known as cholecalciferol and it's a fat soluble vitamin obtained from sun exposure, food, and supplement. It is also known as sunshine vitamin as it is produced by the body in response to the skin being exposed to the sunlight. Vitamin D regulates and modulates physiology and function of multiple human systems, including skeletal muscles. A byproduct of vitamin D helps in contraction and relaxation of the muscles, thus providing strength and support to the skeletal frame of the body. Vitamin D improves the force of muscle contraction. Low levels of vitamin D can reduce number of type 2 muscle fibers which are present in large muscles, and if the number of type 2 muscle fibers are less and the muscle keeps contracting, it is going to lead to a quick fatigue and weakness. Vitamin D improves post workout muscle recovery. Vitamin D improves movement efficacy. Vitamin D has a great role in making the muscle healthier by having a good oxidative capacity. Oxidative capacity is basically muscle's maximal capacity to use the oxygen. So higher the oxidative capacity, healthier the muscle is. Vitamin D is also essential for dental health. It prevents tooth decay and loss, strengthens the gum, and reduces the risk of oral infections. Another main function of vitamin D is working with parathyroid gland. Parathyroid gland regulates the calcium levels in the blood by communicating with kidneys, gut, and skeleton. If the levels of vitamin D are less, the calcium uh, is absorbed less in the intestines, and that can lead to reduced level of calcium in the blood. As a result, parathyroid gland becomes hyperactive and starts producing parathyroid hormone, which makes the gland borrow calcium from bones and leading to a weaker bones. So vitamin D deficiency can be difficult to notice because the symptoms may not occur for several months or several years. You may not even have symptoms at all. Keeping that in mind, it is always helpful to know what are the signs and symptoms to look for. The first and the most important one is frequent illness or infections. Studies show that vitamin D plays a significant role in modulating the innate and adaptive immune response, which helps to keep body healthy. It activates T cells; those are also called as killer cells, which helps to fight the viruses. Vitamin D deficiency is associated with autoimmunity and risk of recurrent infections. The second one is depression or anxiety. So higher levels of vitamin D produces serotonin, which is a neurotransmitter, which regulates mood and is also called as feel good chemical. And if there is a deficiency, the person might definitely feel anxious or depressed. The third one is tiredness and fatigue. The next one is chronic muscle pain, then hair loss and bone loss. So, like I discussed, or like I said, vitamin D plays crucial role in calcium absorption and bone metabolism. So, deficiency can definitely lead to decreased rate of calcium absorption. So, the most important symptom is back pain. Since vitamin D plays an important role in musculoskeletal health, deficiency can lead to muscle weakness. And since the lower back is very well supported by the large muscles like core, buttocks, and the muscles of lower back, weaknesses in this muscle can make it vulnerable to injuries and instabilities. The last one is impaired wound healing. Vitamin D increases the production of compounds that are required or that are crucial for new skin formation as a part of the healing process. Slow wound healing after surgery or after any injury may be the sign that indicates vitamin D deficiency. Two main conditions that can occur in vitamin D deficiencies are the first one is osteomalacia that occurs in adults, and the second one is rickets that occurs in children. So we'll talk about osteomalacia first. Osteomalacia is a condition where the bones become soft and weak, which means they can be easily broken or bent more easily than normal. So in order to protect inner part of the bone, layers of calcium and phosphorus are laid down on the top to form outer shell. The strength of the bone depends on how much of these minerals are laid down. But in vitamin deficiency, since the calcium absorption and phosphate absorption is less, there are high chances that the bone may not have a good strength, can be weak, and can go through multiple fractures. So the symptoms of osteomalacia are painful bones and joints, muscle pain and bone pain after any activity or exercises, recurrent bone fractures of larger bones as in hip bone and lower back, difficulty in walking, or there can be a change in the walking pattern, and recurrent muscle cramps. The second one that I'll be discussing is rickets. Rickets is a skeletal disorder caused by lack of vitamin D. Calcium and phosphate are important nutrients that are essential for bone development and bone growth. Children with rickets have stunted growth, weaker bones, and in severe cases can have skeletal deformities. So the symptoms are oddly shaped skull, bow legs, bumped rib cage, curved spine, pelvic deformities, delayed in tooth formation, frequent fractures, and stunted growth. So a good way is to have a good 12 to 15 minutes of sun exposure early in the morning. Then the impairments that are caused due to deficiencies, as in muscle weakness or difficulty in mobility or recurrent falls, can be taken care with the help of physiotherapy exercises, where we work on the strength, conditioning, balance training, and all the other daily activities that should be carried out safely. So that can be done definitely. You can also avoid alcohol, because alcohol consumption will definitely lead to lower absorption of vitamin D in the gut. Then you can consume vitamin D rich foods on a daily basis. If you are a vegetarian or if you are a vegan, then you might opt for supplements, but I would suggest you should consult your physician first. If you're a meat eater, then you can definitely go for tuna, salmon, sardines, all kind of meat, eggs. And if you're a vegetarian, then you can go for fortified foods. So fortified foods can definitely cover all your supplement insufficiencies. Fortified foods can be milk, yogurt, all the dairy products basically, then egg and cheese, but major chunk of D3 comes from the supplement. Early morning sunlight won't cause any harm. Say around 6 a.m. to 7 a.m. or 8 a.m. is still fine, where the sun is not harsh and you can still sit comfortably and soak all the sunlight as much as possible. But after that, I won't suggest to go for the sun exposure, because the sun becomes harsh and it can be little harmful. So yeah.